How do the symptoms of Lyme disease differ when toxicity is a component?
Okay. So Lyme disease is a chronic infection, and it creates an inflammatory response and an immune response. And mold toxins are they're immunogenic, toxic chemical components that affect the body in different ways. So ways that they affect the body is they cause inflammation, so they can cause brain fog, they can cause dizziness, they can cause visual problems, they can cause respiratory problems. This is mold mainly. Muscle aches, flu-like symptoms, fatigue. And Lyme is very similar, although Lyme may be less respiratory symptoms, but Lyme can also cause brain fog, fatigue, muscle pains, flu-like symptoms, and many signs of chronic inflammation. So mainly the difference is clinical. So in other words, if I'm seeing someone like in my initial history, I go over everything. So what happens is I go over, did they have a tick bite? 50% of cases of Lyme don't see a tick bite. 50% don't even see a classic bullseye rash. But, do they hike? Do they have a dog? Do other members in their family have Lyme disease? And how were the onset of the symptoms? If it was mainly anywhere from May to, late fall. If you think it's Lyme disease, then you do your Lyme testing and you treat with antibiotics and other things. Mold, what you have to do is ask, in your history, what houses have you lived in? How's your house? Do you have a wet basement? Do you smell anything in any area? Has there been any flood? Is there leaks in any rooms? Is there black mold in the bathroom? Do you have chronic sinus infections? Do you have chronic bronchial infections? So when you think that it could be Lyme, then you go on a path to find out that, and we'll talk about that. So Lyme and mold are both really bad insults to the system, and they also get detoxified in the body through the same pathways. So, and that'll lead to other questions that you had.
Okay. Previous to this interview, I did some research, and I read that treatment of Lyme is not as effective unless mold toxicity is treated first. What are the first steps in addressing mold illness?
Well, first of all, anytime you have, it's not only mold, if you have other medical problems like food allergies or other toxicities, that could also make your Lyme worse. So anything that impacts on your immune system can make you worse. So if you suspect Lyme, so the first thing to do is just get a thorough history, like I said. Then what I do in my office is I do a test called the visual contrast sensitivity. It's a very simple test. People can go online and take it. And what they do is have to just set up the computer with the right lighting, and then they answer questions on their light perception, because what happens is mold toxins are very sensitive on the optic nerve. So if you have a positivity on that test, you're assuming that there's neurotoxins. Then what you can do is do certain tests. You do a blood test, you do a SED rate for inflammation, a C-reactive protein for inflammation, and all the standard tests that I might also do in Lyme. But particularly when you think there's neurotoxins from either Lyme or mycotoxins, I do certain tests that show what the cytokine balance is. So there's things in your body that respond to an insult, and they get either produced higher or lower. So one is called an MMP9, one is called an MSH, one is called VIP, one is a VEGF, one is a TGF beta, which is an inflammatory marker. So if those are up, then you know there's inflammation. And then on the other hand, if you're testing Lyme, you're going to do a Lyme ELISA, which is an antibody test, and you're going to do something called an immunoblot, and you're going to test for Lyme plus co-infections, which could be Bartonella, Babesia, Ehrlichia, Anaplasmosis, Mycoplasma, and other various viruses, perwas, and things like that. So you just have to first assess clinically, see what you think could be the cause. Is it Lyme alone? Is it mold alone? Is it Lyme and mold? Does the person really have a lot of neurological problems? So then the second step is you might want to do a regular MRI for Lyme, but for mold we sometimes do something called the quant brain MRI, which is a special program on top of an MRI that can show various diminution of certain areas in the brain, like the hippocampus, which is memory, or different areas like that.
How would the difference in the MRIs, how would they look? Like, what would be something to look for by the doctor?
Well, for Lyme, so for Lyme, you're really looking for any structural abnormalities, like what they call flares, problems in the white matter. That can also look like MS, and that's important because, if someone just goes to a neurologist with some of the symptoms they have in Lyme, they can make a diagnosis of MS. But if the neurologist isn't literate in Lyme, he may just say, oh, you have MS. Whereas Lyme disease can be one of the things that can be the inciting infection that causes the inflammation that's in the myelin of the nerves. So you always have to look at the whole picture. One interesting thing that I like people to know is if they have neuro-Lyme, that's Lyme in the brain. If you have 100 patients that have Lyme in the brain and you do a spinal tap, so that's 100 patients that definitely have the disease, only 35 will be positive. So that's not a very sensitive test, but a lot of neurologists think if they have MS, okay, I want to rule out Lyme, I'll do a spinal tap. It's negative, okay, you don't have Lyme, then they rule that out, and they go down another treatment path, and they could be missing something that's causing, the neurological problems. And with the MRI on mold patients, you're looking basically at areas of the brain that could be affected by the inflammation, less so for MS, but more so for decrease in the brain in certain areas from chronic inflammation.
I also read that mold toxicity is caused by mycotoxins. Is it true that those with Lyme, if exposed to mycotoxins, the mold symptoms that occur can neutralize the treatment prescribed?
Well, first of all, mold is what someone's exposed to. What the mold does is create neurotoxins. So what happens when you have a mold problem, you could, and it's very important to differentiate this, you can have a mold allergy, which has nothing to do with toxicity. It just creates an immune response, generally in the sinuses and upper respiratory, rhinitis, and things like that, as opposed to the mycotoxins, which are produced by the Lyme. By the mold. So that's a distinction. One is the mold that could be in the environment, and the other is what's being produced in the mold that's showing up in the body and causing symptoms.
Okay. Is the treatment of mold illness different in a patient with Lyme disease compared to a patient without it? And if yes, how so?
No, basically, anything like Lyme disease, if you have a underlying condition like mold, is going to either make it worse or make it harder to treat. So it just depends on the patient. Some patients would say, okay, you have to treat mold before Lyme. Sometimes I'm treating both. Sometimes the Lyme is really bad. I'll treat the Lyme, and then all of a sudden someone will manifest other symptoms that are coming out in their environment because now their immune system has been a little bit cleared, but now they got to take care of the mold. So, for instance, I had a patient who I treated for Lyme and did relatively well. Then she had a problem. I guess she had a leak in her house that she didn't know about. She started having these symptoms. They weren't quite like her Lyme symptoms. I diagnosed mold toxicity with mold toxins. I treated her for the mycotoxins. She got better. Then just recently she started having symptoms again. I said, what's going on? And then on questioning, it turned out that the other mold problem was in her home. And this time she had been back to work, and I said, well, I'm sick most of the time when I go to work, and on the weekends I'm all right. She found out that there was a really bad mold problem at work, so she was exposed to molds again. And, if someone has a mold problem and they're out of a situation, if they get into another one, their body can be weakened because it's already been weak on that particular immune problem.
Does having had or currently having Lyme disease make one more susceptible to mold sensitivity?
Well, yeah, Lyme is an insult to the immune system. So anytime you've had Lyme, you're more susceptible to get problems from something like mycotoxins. And that's the same thing. Let's just turn that around in COVID now. So a lot of my Lyme patients I've told, hey, your natural killer cells are down, your immune system is down. Yeah, you have to be really vigilant with COVID. So then I give people certain things to build up their immune system so that, they're less susceptible to viruses. With mold, it's different. You really have to make sure they're out of their environment. The thing about mold toxicity is someone can't remediate. When you're trying to get rid of mold, you call on someone to remediate it and, either take out the construction that's bad or use certain things like vinegar and, bleach and stuff to kill the mold. But what happens is that's going to release particles from the mold. So you can't, so someone will have, let's say a woman has mold, and then she'll say, okay, well, my husband's just doing everything in the house, in the basement to clean up. Well, she can get worse because she's in the house. So a lot of times you'll find people have to just, if it's really bad, just get out of the house, go get a new set of clothes at Walmart or something, just a new set that's cheap, not an expensive pair of clothes. But all their clothes can't go into their new place if they're moving out of their house. Same thing with some of their furniture. If it's material and porous, the mold will go in there and it'll go right to the new place. So the best thing when you're initially treating someone with mold, if it's severe, to get them out of the dwelling that's infected and have someone come in professionally and clean it up, and then treat it by giving certain binders which help get the molds out through the body.
How often would you say there are cases of that where people have to leave their home compared to a smaller fix, I guess?
Yeah, I would say 20-25% of my cases, I have to have someone go out. But, the majority, they could stay in if it's a room, and they wall it off, and they take care of it, and they put an air purifier, and they take binders, and it's only a localized area. But if it's, the whole house, they have to be out.
Does having a history with mold sensitivity make one more susceptible to Lyme disease?
Well, again, what a mold toxin is allergenic toxin. It's a inflammatory toxin. It's a immune toxin. So sure, anybody's had, ongoing mold. If they've been through it, they probably are a little bit compromised, but not terribly.
If a mold allergy can be similar in symptoms to seasonal allergies, how can one differentiate if it's just seasonal or if further measures are needed if it is a mold allergy?
Okay, so so now you have a mold problem. So then you have to decide, like I said, mold can be an allergic problem or it can be a mold toxin problem. They're two different things and they can coexist. Someone could be allergic, it doesn't mean they're not toxic. So what you have to do again is take a history, see if it's more localized, if it's in the nose and a lot of rhinitis, a lot of sinus problems, some bronchitis and things like that, very localized. And then you do testing on them. You do either blood test called RAS test or you do intradermal testing on the skin if they're positive for molds, and you diagnose that it's a mold respiratory allergy. Then you could treat them with either antihistamines, so you can treat them with inhaled steroids, which usually stay away from, or you could treat them with Chromalin, which is what they call a mast cell blocker, because a lot of times what mold is doing is stimulating a histamine response, and that could lead to a whole other source of inflammation. Activating what the cells in the body called mast cells, and so that's where mold can really pile on the inflammation in a person. But once you've handled the allergy, if that's the problem, then that's one specific. Then the other side of that is the mycotoxins. And when you think that it's a mycotoxin problem, you can get a urine analysis, and a urine from certain companies will show the metabolites, that's the breakdown products of the mold in the urine. If those are positive, then you make a clinical diagnosis that they're reactive to mold toxins, and then what you have to do is give them a certain kind of diet. We usually put them on a very low sugar or a low amylose diet. You may want to treat them with nystatin or diflucan, which are anti-candida medicines, because candida is also a mold. And then you want to give them certain binders like cholestyramine or bentonite, which is like a clay, or zeolite, things like that.
Is there a statistic of Lyme patients who have a co-condition of mold-related illness, or is there a probability of if you are positive with one, you are for the other?
No, they are two different entities, but the way the body handles mycotoxins and Lyme toxins is through the same detox pathways. So that's where it kind of blends, but they're two different illnesses.
What are steps that people can take to protect themselves from mold illness?
Well, vigilance. They have to look at their homes. They have to repair things. They have to make sure the roof doesn't leak. They can't dismiss, a small leak that all of a sudden can cause mold growth. They have to watch for any odors that are in the basement. They have to use dehumidifiers, maybe air cleaners, and things like that. So with mold, the most important part is prevention.
Okay.
Because once there's a problem, then it's creating this whole chronic inflammatory response.
Getting into the questions that were submitted to the Lyme Advised Facebook page, what is your treatment approach for mold illness?
Well, like I said, first you take a complete clinical history. Then you do the test that I said, the VCS test, to see whether there's indications. Then you do routine inflammatory and immune tests. And then you do those tests that I said, which are cytokine measurements, MSH, MR, TGF-beta, and you see the levels of those. And then what you do is you put them on a diet that's a low sugar, low amylose diet, and other nutrients to balance their immune system, like that.
What homework?
And then of course the binders, which are really important to get the mold toxins out. And of course, getting testing on the urine to see which mold is the perpetrator.
What home or work tests do you recommend, and what blood markers do you suggest?
Well, I covered those. You have those.
Okay. And can we swab or test ourselves at home for mold and send it to lab for results? And if so, how do we find that test or lab?
Well, there is a test that if someone has mold problems, they can also have infections in the nose. Like they can have what they call Marcans, which is a coagulase negative staph that tends to make the mold worse. So you can take a swab deep in the nose for that, and at the same time you could be taking a fungal swab, and that's a test that goes to a particular lab, which I don't have the name of now. My office just sends it off, But there's a specialty lab that goes to.
Okay.
It's called the Marcans test.
Okay. Is there anything else? Those are all my questions. So is there anything else that perhaps I didn't mention that you would like to touch on?
No, I think your questions were really comprehensive. I think we covered everything with clinical diagnosis, testing, evaluation, treatment. Yep.
All right. Thank you so much for your time.
Okay, have a great Memorial Day.
Thank you. You too.
Okay, bye.